you've never heard of implants before, I think you need to start with what are the alternatives, and there are alternatives. So you can look at a denture, you can look at a bridge, you can look at an implant. I think you want to challenge how many implants you need. If you're only missing one tooth, well, that's obvious, one implant is fine. But if you're missing 2 or 3 or more teeth, that doesn't mean you need 2 or 3 or more implants. So I think you also want to challenge the notion that you need an implant per tooth. So you can ask questions around that. I think it's important to understand the materials that are going to be used, what implant design are they going to be using, and if you want, you can ask more about the research and the longevity of that implant modality and that treatment option. And then there's also the materials that can be used if you're rebuilding an area and increasing the bone volume or the soft tissue in that area. The other key questions are, I think, are about the education and the experience of the clinician. Anyone can place an implant in 2025 with a small amount of training, and that's great because it means more people get access to dental implants. But if you're feeling that your case might be a little bit more complicated, I think you want to stress test the clinician and make sure they feel confident to manage your case. You can ask how often they do this. You can ask how many implants they've done, what education and training they've had. And I think generally then you can use your intuition to see whether you feel confident in that space.